I grew up having staffings, we call it, and we did those at the Baylor College of Medicine, the Methodist Hospital in Houston, and Jim Jerger was my boss. And I was there as a young PhD student, and I was there for 11 years overall. We staffed cases 4 nights a week, and I found it to be such an important part of teaching and learning that I've carried that wherever I've gone. So when I got to Henry Ford, we began staffing once a week on Tuesday mornings, and that it's a process of teaching and learning through our patients. We have externs. We have 4 externs from around the country. We also have a number of students from the Wayne State University who come through, and it's very difficult to know it's very difficult to know what they don't know when we're trying to teach them in the clinical realm. And we find that that by teaching through staffing, we're able to identify those areas where there might be weakness, where gaps in their knowledge. It's also a way that we can teach our senior staff without putting them on the spot, and helping them to understand how to teach the students by learning why we think, how we think, and why we do what we do. So, we think that it's a part of our assessment of these externs and students. We think that assessment drives learning, and so the whole process is one of trying to teach and learn from each other and from our patients.
The thing is, clinical care is inherently confusing, and students, when they come in, they don't like that. And this is a way to help them understand, to embrace that confusion, to embrace, what they need to learn from a patient. And so it's a good opportunity to bring them into that process of being able to become lifelong learners and reevaluate all the time what they're doing and learn from it. These case staffings, depending on how it's done, it could be intimidating for a lot of people, and we just don't do it that way. It's meant to be a positive learning experience for everybody who's involved. So it's really sometimes you talk about teaching hospitals or teaching facilities, and I just really think of what we're doing as we're a learning hospital and we're a learning facility, and we're learning from our patients, all of us, all the time. And everybody's bringing something unique to the table. Everybody's having unique experiences, and so I think if we kind of approach it from that perspective, that's what staffing is about. It's about learning and learning from our patients rather than teaching to students. Are there times when we can step back and you can offer some perspective on broadband noise reflexes and absolutely, and that's just that filling in the gaps in knowledge where somebody else can bring some evidence-based article or something that they've read in their experiences as well. So it's a collaborative process.
I always think if Jim Jerger can learn from patients, if Jim Jerger can learn from his colleagues, from his young student colleagues, then certainly I can. And certainly everybody else in the room can. So get over it. There's no room for defensiveness. We're all here to learn from each other and from the process.